Welcome everybody to the Learning from Review's Lunch and Learn session on pressure ulcers. I don't know whether that's the right subject to do on a lunch and learn, but we'll give it a go. So yeah, we've got a lot of people coming onto the call that have registered today. So welcome to everybody. I'll just go through a few housekeeping issues on just so everybody's aware. We are recording the session today to do a learning session, so we've got a video of the session. Okay, so just in terms of housekeeping, we are keeping people the cameras off and on mute until we've got it. We're doing questions and answers in the chat, if that's okay. If you're in an open space, you know, we are covering safeguarding reviews, so if you can be aware of your surroundings and use headphones if you can. We will be sharing the presentation with everybody and the 7-minute briefing that we'll refer to as well. So you will have this and the link to the recording after this session if you want to share it with any colleagues. So like I said, if you do put any questions that you have for anybody in the chat, we'll do our best to get through them. We will absolutely finish at the latest at 1:30. So if there's any that we don't get to, we will follow those up with responses. And just a final thing really, you know, is a safeguarding focus on this session. So if you're affected by anything, please speak to your manager if you come off the call and you're affected by anything that we cover in the content today. So please just be mindful of your own, you know, your own emotions really. Okay. So the aims and the objectives of this session, like I said, it's for no more than an hour. So it's really to raise awareness of the guidance and support available on pressure ulcers. And by the end of the session, hopefully you'll be aware of the a review that we've had around pressure ulcers, changes to the national guidance that came in earlier this year, and the training that's available as well. We've got links in the 7-minute briefing to any training offers, and also when to raise a safeguarding concern. And there will be opportunity hopefully to ask questions with some key people on the call, who I shall introduce now. So if I just bring Catherine in, do you want to introduce yourself, please?
Hiya, I'm Catherine Morgan. I'm the Matron for Tissue Viability for Lancashire and South Cumbria NHS Trust.
Lovely, thank you, Catherine. Lisa, can I bring you in too, please?
Hello, my name's Lisa Settle. I'm the Triage Manager with Adult Safeguarding at Lancashire County Council.
Lovely, thank you. And Bridget as well, can I bring you in?
Hi everyone, I'm Bridget Welch. I'm one of the specialist safeguarding practitioners working for the ICB, and I chaired one of the safeguarding adult reviews that is mentioned in the presentation today.
Thanks, Bridget. Can I just check, is there any issues just from the presenters really? Can you hear any issues with sound? Because we've got something on the chat about distortion with sound.
I can hear fine.
Yeah, it's okay. So maybe maybe you want to come back in and leave and come back in again, that might help. Okay, so what I'll do first, some people on the call might not be aware about the details about pressure ulcers. So it's only a 5-minute video, so I'm going to unshare, link to the video, and hopefully it'll all work for you, and we'll just look through that first to try and as a bit of an overview to the session.
Pressure sores are localized injury to the skin and underlying tissue, and it usually occurs over bony areas, and it's the result of prolonged unrelieved pressure. There are certain risk factors that put you at risk of pressure sores. So these include friction, impaired sensory perception, where you're unable to feel certain sensations, especially pressure, impaired physical mobility, altered level of consciousness, for example, if you're in a coma, dehydration, elderly patients, and chronic medical conditions like diabetes. So how do pressure sores occur? So whatever the risk factor is, it results in pressure application over soft tissues in a bony area. This pressure will exceed the normal capillary pressure, and what happens is we have occlusion and tearing of small blood vessels, we have reduced tissue perfusion. Eventually this leads to ischemic necrosis, where the cells and tissues start to die, and then we have the formation of a pressure sore or a pressure ulcer. The common sites of pressure sores include the elbows, the inner knees, the back of the head or the ears, the buttocks, and the hip. We can classify pressure ulcers in 4 different stages, and it's always going to be based on the depth of the tissue destroyed. So stage 1 involves the epidermal layer of the skin. The skin is actually intact, but there is redness called an erythema in the area affected, and this redness is non-blanchable, so when you press it, it doesn't turn white. It's usually occurring over a bony prominence. You'll see discoloration of the skin, edema, and pain in the area. It's important to recognize if the patient is a high-risk patient, for example, if they're in a coma, if they're elderly, if they have reduced mobility. So at this stage, it's a key thing to kind of keep an eye out because you can notice the pressure sores starting to develop in stage 1. Stage 2 is called partial thickness. An impartial thickness, we have loss of the dermis, there's a shallow open ulcer, and there's a pink wound which develops. In stage 2, there's damage to the epidermis and the dermis. An ulcer starts to form and it looks like a small blister or an abrasion lesion. This is stage 2 partial thickness. Stage 3 is when we have full thickness tissue loss. You might be able to see some subcutaneous fat visible. At this stage, there isn't any bone or muscle or tendon involvement, but you do see subcutaneous fat. Stage 3 involves the epidermis, the dermis, and the subcutaneous tissues. Stage 4 is the deepest form of the ulcer. It extends into the muscle, the tendon, and the bone, and there is full thickness tissue loss. The complications of pressure sores is that it can result in sepsis, bone infections, cellulitis, and that's due to infiltration of bacteria into the open wound. So how can you prevent pressure sores? As soon as it's recognized that a person is at risk of developing pressure sores, it's important to relieve the direct pressure, and you can do this by changing positions, even if you're moving the patient around if it's not yourself that's being affected, but make sure there's enough movement to kind of reduce the pressure in that particular area, standing up, or repositioning the patient regularly, at least every 2 hours. You can also get special pressure relieving mattresses and cushions. Other tips include keeping the skin clean, moisturizing the skin thoroughly, eating a well-balanced diet, having enough fluid per day, at least 2 liters, and informing your doctor if you've noticed any skin changes in certain areas. So when ulcerations are present or these pressure sores are present, you can do certain things to help treat it. There are special dressings which are used to protect pressure ulcers, and it helps to speed up the healing process. So these can be alginate dressings, hydrocolloid dressings, or it could be a sort of foam dressing which can be applied as well. Topical antiseptics or antimicrobial creams aren't really recommended, to be honest. The main and most important thing are barrier creams which protect the skin that's been damaged or irritated by the high pressure. Antibiotics could be used to treat an infected ulcer, or if there is a serious infection like sepsis or bacterial infection of the tissues under the skin like cellulitis. In that case, antibiotics can be prescribed. We've already mentioned eating a healthy and balanced diet is important because that can help speed up the healing process. And the final treatment we're going to talk about for pressure ulcers is what we do with the damaged tissue. So it can be removed in a process called debridement. And this is sometimes necessary to remove the dead tissue, the necrotic tissue, to help it heal. So you can remove the large amounts of dead tissues in a few ways. You can use ultrasound, surgical instruments like a scalpel and forceps, or high pressure water jets. Local anesthetic is usually used around the area to numb the areas so the debridement is pain-free. And the surgery is done to seal the wound to help speed up the healing and minimize the risk of infection. Surgical treatment involves cleaning the wound, closing it by bringing the edges of it together, using tissue from healthy skin nearby to close the ulcer. The problem with pressure ulcers, it can be challenging because the problem with pressure ulcer surgery is it can be challenging because the people who have pressure ulcers developing are usually generally in a poorer state of health. There are risks associated with the surgery, and that can include necrosis of the implanted tissue that you place in. There is a risk of infection of the bone. Abscesses could develop, or even deep vein thrombosis. So that's all we're going to discuss in today's video. Leave a 100 emoji if you've made it all the way to the end.
Okay, that link for that video will be is on the 7-minute briefing that we're going to share. Okay, so so now we've had that overview, I'll just take you through over the next sort of 5-10 minutes around the safeguarding adult review that we've had that was related to pressure sores. So just a very quick summary. So safeguarding adult review is basically a multi-agency review process which looks at determining what relevant agencies and individuals could have done differently to help prevent harm or a death taking place, and certainly learning lessons from that to reduce risk of the same situation happening again in the future. It's absolutely not about apportioning blame. It's about effective learning and improvements to practice to help reduce that risk of future deaths or serious harm happening. So a few years ago we had the case of May. Just as a bit of a brief overview, May was a 71-year-old female who died quite suddenly at home. The post-mortem results indicated that the cause of death was sepsis with evidence of pressure ulcers. She lived alone, she was overweight, and she had multiple health problems and limited mobility. She had periods of low mood and anxiety, and there was some hoarding behaviours and a degree of learning difficulties. So just, you know, a lot going on in May's life. She had 5 calls each day from 2 provider agencies, and she also had support from district nurses, and the GP spent visited her as well as some hospital inpatient treatment, and she also had social care support. So there was regular visits. There was a lot of things going on with May, a lot of people going through the door. So despite the complex health needs, a death wasn't expected. So because of that, really, that was felt that May was an adult at risk with health and support needs, and the circumstances, you know, possibly led to suspicion of like possible neglect and concerns. In the safeguarding, the full report, it mentioned that ambulance staff identified a grade 3 pressure ulcer. So we've already heard that is quite significant to May's back, and there was no signs of any treatment to address that. The review was published back in 2019 and had a number of recommendations, and we have the learning brief. I put the link on there that's on our Safeguarding Adults Board website if anybody wants to look at that in detail. I'm not going to go through all of these. I know it's quite text heavy, this slide, and just shows some of the things that we've moved on from within that the last few years, really, with this how we manage pressure sores. But some of the learning was quite typical of multi-agency reviews that we see, quite a lot around MDT working and multi-agency support and escalation around issues when people are found something that is getting worse, a situation that's getting worse. So you know, there's quite a bit in there about, well, how do we escalate that and who do we tell and get involved. There was information about providing briefings to care agencies about pressure sores and about learning from reviews, and self-neglect. The self-neglect hoarding framework was flagged up, that was put together in 2019. So there was that, the awareness of that, and what to use in terms of actions to take. And about linking in with resources and potentially looking at prevention events as a wider system point of view. I've put a couple of things in red. I think Skype, it was the in thing in COVID, wasn't it, when we started out, but it would obviously now do quite a lot of business pretty much through Teams, but having that virtual you know, ability to meet together as multi-agency teams was seen as a key thing of the report. And the Reactive Red Skin campaign was mentioned as part of the recommendations, which we've moved away from now. So we've updated the guidance in view of the new guidelines, and Catherine's helped with quite a lot of that information. And we've also, because of the new guidance, we've taken away the best practice guidance. We had a localised Lancashire guidance for pressure ulcers, but actually we've, from quite a lot of reviews and discussion with partners, we agreed that actually we will link straight to the national guidance. It's very comprehensive and very good in terms of identifying what needs to be done. So Catherine and Lisa will go through that in a couple of minutes. So just in terms of updates on that review, like I said, a few things have happened since obviously 5 years ago. We are going through the self-neglect framework at the moment. We're refreshing that. We want to make it much more easy to use for practitioners, and really be really clear on the sort of level of need and when to identify and what legislation can be used to support people who self-neglect, because we do find that there's quite a lot of non-engagement alongside self-neglect, and how do we tackle that if we think actually somebody's getting to a position that they're at risk to themselves or to others. We've got some really good care sector health and social care safeguarding champions networks that meet on a regular basis throughout the year, covering lots of different subjects. We've got a task and finish group that's looking at mental capacity act information. There's lots of guidance being refreshed in the last sort of 6 months, and we're carrying on with that and looking at how we raise that awareness about that guidance that's available. It includes restricted practice and executive functioning. So there's lots of new guidance coming up. So you'll be seeing more of that from us over the next few months. We've commissioned Health Watch. The voice of May was very much featured in the report. So how we listen to people, being person-centred. So we commissioned Health Watch in Lancashire to have a look at, well, how can we get better at communicating with people? So we've done that report, and we're acting on the recommendations from that. And we've put all this together. So this slide deck, really, all the information that we're providing to you is all within a 7-minute briefing. So if you wanted to use that to cascade down to your teams and share that information, there's training links on there, and there's the asking framework that's available. There's a link on there as well about that. Okay, I'll hand over to Catherine now.
Thanks, Hayley. So yeah, some gruesome pictures there if you're eating your dinner, so apologies. So pressure ulcers, as we know, they're largely preventable, and they do cause an enormous amount of distress to patients and their families, as well as additional financial pressures for the NHS, as I'm sure we all know. Treatment and response to pressure ulcers is a predominantly clinical one, but preventing them is everybody's responsibility, and that's come from the Department of Health this year, who've issued new guidance. So as we've said, the Adult Safeguarding Decision Guide was launched a few months ago now, and helps give clinicians and carers and patients themselves a guide to whether they require a referral to an LCC Adult Safeguarding team. The guide itself looks at the patient's pressure damage, asks whether that's consistent with their risk status. It looks at the patient's condition itself. So has the patient had an acute illness that's led to the development of the pressure damage? Is there a personalised pressure ulcer prevention care plan? And is the patient concordant with that care plan? It looks at any concerns relating to care provided from an informal caregiver, so whether there's been any willful prevention of access to services, that sort of thing. And it also looks at the patient's mental capacity. A score of 15 or more indicates that the safeguarding alert should be raised, but obviously that's at the clinician's discretion. So if you do get a safeguarding score of 15, but you're confident that everything is in place, then that would be a clinical discretion, but the guidance is 15 or more. The Department of Health also advocates the use of a body map in order to document skin damage. These are really, really useful for documenting things like hospital admissions. So if a patient leaves your service and goes to attend a hospital appointment, perhaps on a stretcher, or they're having a hospital admission, it would be really good practice to body map them before they go, and then body map them again on return. And that just helps keep a track of any pressure damage that's developed outside of your care that you may be reporting. All the information for both those documents are included on the link below, and I'll happily answer any questions later.
Hello, I'll take the mute off before I start. So we'll start with the safeguarding criteria, which I'm sure you're all aware of. The people you're supporting, if they're in a residential and nursing setting, then they clearly meet the first element of criteria, which is the person has to have care and support needs. They're experiencing or at risk of experiencing abuse, and as a result of the care and support needs, they're unable to protect themselves. So the local authority, the adult safeguarding team, has a duty to make inquiries and determine if we need to take any action if those 3 elements of the criteria are met. So in relation to when to raise a concern, the new guidance is brilliant. Prior to this, it were anything over a stage 3, so we'd get lots of safeguarding alerts and we'd contact district nurses or TVM or the care providers, and they'd say there's no concerns around kind of neglect, acts of omission. Everything's in place, all relevant equipment's in place, but they've raised it for kind of information sharing. But once it's been raised and we've opened that section 42, we then have to get in touch with family. It can be quite distressing. So this new guidance kind of prevents that, and it lets us really focus on the safeguarding concerns that we need to be looking at. So if you've got any concerns around kind of pressure damage, where you feel there's been an omission of care, maybe repositioning hasn't been done as regularly as it should be, the pressure damage wasn't identified as soon as it could have been, maybe a referral to district nurses or TVN should have been done sooner than it was, raise a safeguarding. If you're ever at a point where you kind of not sure, maybe it's on the borderline, you've done the pro forma, you've gone through those 6 questions, and it's saying you shouldn't, but you feel like you should, raise it with us and we'll have a look, but always be guided by that kind of pro forma and the new guidance. If you're ever kind of unsure, you can always drop us an email and kind of run something by us and ask us, and obviously use your guidance. Have we got any DOM providers on, Hayley, or are we all residential and nursing?
I think it was across the board. I think we sent it through to.
Right, okay.
Unless
I was just wondering, just because, yeah, this next bit's just about kind of informal support. So I just wanted to make sure it were relevant. So for kind of home care providers, dom care, if we're supporting people at home and family are providing informal care between visits, so the person might need kind of, you know, support with repositioning and mobilising, and there's concerns around not getting the right level of care there. Again, we can kind of look at the guidance, look at, you know, district nurses' involvement, get them to complete the pro forma to look at the following kind of elements. It's not necessarily that they're neglecting. Do they know how to support that person to prevent pressure damage? Are the person themselves aware of how to prevent pressure damage? Are they engaging with all the care and support that's provided? So it's just about asking those questions and using professional curiosity and professional judgment. An example case of one that's come in this week is an individual with a necrotic foot. So they were at home with their family, didn't have any formal support in place, but quite a few professionals had been in and kind of noted the smell, but didn't ask to have a look. And she'd hidden it and not told anybody. But maybe if there were a bit more professional curiosity and they'd asked those questions, investigated that smell, they might have kind of got to it sooner. So that individual's going to have the foot removed due to that. So it's just kind of asking those questions and being nosy. If you come across kind of cases where family are ignoring medical, emotional and physical care needs, they're blocking access to healthcare and support, or just not engaging at all with health professionals, always raise it with us and then we can support and have a look at that. So if an individual has capacity and is just declining support, not engaging, and you know they've got that pressure damage, it's deteriorating, they won't allow health professionals to address it, they won't allow care staff to support with personal care, we would recommend requesting assessment or review from adult social care. So the self-neglect framework can be followed, and it'll ensure that multi-agency response. If there continues to be risk that can't be managed with all relevant agencies involved, then we'd ask for a safeguarding to be raised, just so we can kind of support that multi-agency response and oversee and see if there's anything else possible that can be done to support that person. In situations where somebody lacks capacity and they're not engaging, and risks are increasing due to that. So again, they're not allowing you know, staff to support with personal care, not allowing health professionals to dress wounds, not concordant with medication, and the significant risk that can't be managed with those involved agencies, again, raise a safeguarding concern, and we can support and oversee and see if there's anything else we can add.
Yeah, thank you. So yeah, and that was quite obviously a stark example you've had of that this week, haven't you, with that lady and a foot needing to be removed. Then you know, that sort of brings it home quite a bit, that, doesn't it, around the implications of what happens if it's not treated early. And I think there is one of the questions in the chat was around having posters in nursing homes available, and it just struck me as you were going through it then, Lisa, about information to families and to people who are being treated for pressure sores. Is there something available that is given out to people, or that you're aware of, or Catherine?
I'm not sure.
Right, how about you, Catherine?
So if the patients that are under the care of our community teams would be given a personalised advice sheet using the asking framework, and it's a duplicate copy that the nurse will write. She'll keep a copy in their notes and give a copy to either the patient or the domiciliary care team, just to make sure that any messages are consistent, the patient's on board with the plan, and that we're all working from the same hymn sheet, really. In terms of leaflets and other information for patients, the Reactor Red, as you alluded to before, is being phased out because it's no longer meeting the needs of our population. So we are looking at doing a new leaflet, which we can share in the coming months when it's passed through our graphic design team.
Brilliant, that's really good. And I suppose if there's a leaflet, I suppose there's a bit of a cheeky ask there, isn't there, around is it possible to develop some posters to go alongside that leaflet? Maybe that might be quite helpful. I'm
sure that'd be easy to do, yeah. From the
yeah, if the graphics are already there,
it's just getting it through graphic design, because yeah, it's hard to find free images to use for these things.
I know. I hear your pain there. So yeah, so that's something we'll definitely keep people in the loop on. And there is a pressure sores, World Pressure Sore Day, Ulcer Day, I think it is, coming up in, I think it's November time. So I would imagine there'll be quite a lot of media and information resources around that. So we'll certainly send information out when that's available. That response, Catherine, brings us nicely on. We have done this session before, so we had a couple of questions raised, and the asking framework is sort of a national assessment tool. So that we got asked around, well, does that replace, how is it used in conjunction with the Waterloo assessment tool that many of you might be familiar with? So I don't know whether, Catherine, you want to expand on that, because there was a sort of a rollout programme, wasn't there, around using that best practice?
Yes, there was. So your Waterloo assessment tool is an assessment of risk. So that's the patient's risk status for development of pressure ulcers. That forms part of the asking, but both need to be completed. So if the A for the small a on your asking framework is about assessing risk, and that's where the Waterloo comes in. So looking at your patient and looking at what their risk status is, not just using the Waterloo, but looking at things like their capacity and concordance. So yeah, all of that would be captured under A. The first S is for skin inspection, so that's a head to toe skin inspection to check that the patient is free from pressure ulcers, or if not, to body map them and to record any vulnerable areas or any areas of damage. The second S is for support surface. So that's thinking about the mattress that the patient lies on. That could be a static mattress, it could be an alternating cell mattress, it could be a wheelchair cushion that they sit on all day, it could be a recliner chair that they sit on all day. Are they using a footstool? Because we see damage when patients elevating the legs on footstools and they're not offloading their heels. So it's thinking about all equipment that the patient comes into contact with in that 24-hour period. The K is for keep moving, so that's looking at a mobility status primarily. So can the patient mobilise? Can the patient move themselves once they're in bed? Are they relying on a carer to help them reposition, or can they do that themselves? Obviously then it's thinking about times of visits. So for instance, if their last call is 8 o'clock at night and then their morning call isn't till 10 o'clock the next morning, that's a long time for them to be led in one position if they can't reposition themselves, which puts them at higher risk of pressure damage. The I is for incontinence. So how we manage the incontinence, because incontinence is a risk factor for development of pressure damage, because incontinence damages the skin's pH and can break the skin down. So thinking of things like catheters, sheaths, incontinence pads, and the use of barrier creams, barrier films, and how we're washing somebody's skin, so making sure we're not washing with perfumed soap, that sort of thing. The N is for nutrition and hydration, so making sure that a patient is eating and drinking enough for them. Obviously, if they do have any wounds or areas of damage, they are going to require more nutritional vitamins and nutrients to help that pressure ulcer heal. So that it maybe then having a conversation with the GP or their visiting nurse to see about assessing their nutrition. And also flagging up if they're noticeably losing weight, because that in itself is a risk factor for pressure ulcer development. And the G is for giving information, so that's where we talked about the duplicate asking care sheet that is given out by some of our community teams, and that's just to make sure that the patient's got some information, that we're sharing information between ourselves as healthcare professionals, and that we're all working towards the same goals for that patient.
That's brilliant. Thank you for that, Catherine. Really helpful. So I know we've had a question about the 7-minute briefing. So we will send the 7-minute briefing out as part of the follow-up to this call today, and we'll also send the link. So all the 7-minute briefings are sat on the Lancashire Safeguarding Adults Board website. There's quite a lot of information around for providers. We've recently put, I'll give Bridget a plug because I know Bridget's worked on this quite a bit. So there's one on restricted practice in positive behaviours. So to follow on from the work that some of you might be aware of around Aqua project. So that is on the website as well. So yeah, so it's all on there, and the asking framework that Catherine just went through, that the links and the details on that are on the 7-minute briefing. So I think one of the other questions that we were asked last time was around the MASH service, but we were given assurance that there wasn't any backlogs in relation to managing safeguarding concerns, and there wasn't anything specifically outstanding on pressure ulcers. I know Lisa is absolutely on it, on cases that you get, aren't you? So I think I don't put you on the spot.
Actually, sorry, Hayley, we don't actually have a MASH anymore. So we're one service, so things get screened on the day they come in by me, and are sent out the same day. If they're ranked green, they will sit in a pending tray to be allocated at the end of the week with available spaces. So there's a constant turnaround. I think we've got 50 waiting to be allocated, which will go out tomorrow.
Right, that's great. Thanks, Lisa. And you mentioned about if people do have concerns or they're not quite sure whether to put a safeguarding concern in, to email. So would you be able to share whatever the relevant email is with me?
I'll send you the safeguarding support team's email. They can also come out and do support and training with providers around safeguarding and when to raise a safeguarding and things like that. If anybody feels they could benefit from that.
Right, that seems a really good shout, that. So yeah, that would be really helpful. Thank you. Okay, so I think we've pretty much, has anybody got any other questions that they want to pop on the chat? Because I think we've gone through everything that we've set out to do. Hopefully we've given you a good overview of what pressure ulcers are about, you know, why we've, you know, highlighted this as an issue, what the guidance is around looking and managing pressure ulcers, and how and when to best to raise a safeguarding concern, and other guidance that's available. So hopefully, you know, that you found the session useful. Always welcoming feedback, and I cannot let you all go without plugging the Safeguarding Adults week, which is coming up in November. There's lots of other webinars that we've got available. There's a drop-in service that we're doing, like a bit of a virtual drop-in. So we have information from Aqua, a project that I mentioned. Paul Greenwood is coming to do a session on restricted practice and the best practice that's been found, and that links to the 7-minute briefing that we talked about. There's also one on modern slavery, which you might not think is perhaps relevant, but I know Sean Hall, who he's been coming out to quite a few care homes about that as an issue, because you know, people are being brought in under that under care roles. So that might be of interest. And then we've also got these drop-in sessions which bring in encompasses the carer service. We've got the fire service around home-based fire safety checks, and quite a number of services. So we'll send all the information out to the normal networks of how you pick this session up. So it's all there for you to be involved in if you'd like to get involved. So it's all through the week for Safeguarding Adults Week. That starts on the 18th of November. Okay. Lovely. I know you're all very busy people. Really appreciate your time, and thank you for coming and listening to us. Well, have a good rest of day.